Welcome, everyone. I am glad you're here. So, today's conversation is going to be a little more personal because I want to talk to you about Medicare, not just as a professional, but as someone whose own family has had to make these decisions too. Over the years, I've noticed something. The things that I wanted my own family to understand before starting Medicare, that they're the same things that I want you to understand too. Not the commercials, not the hype, not the best deal, just the core things that really matter once real life starts happening. So if you're approaching Medicare or you're helping a parent or a spouse or even a friend or coworker through it, type family in the comments. We haven't met yet. I'm Casey. I'm part of a family-owned Medicare agency founded almost 30 years ago. We're based here in Margate, Florida, which is just outside of Fort Lauderdale. And over that time, we have helped literally thousands of folks all throughout Florida and really all throughout the country walk through these very challenging decisions and design a coverage strategy that fits their lives the way that they want to live it. Many of my clients refer to me as their Medicare co-pilot, not just because I'm a licensed pilot, I am, but more importantly, because planning Medicare, well, it's a lot like planning a flight. The important part starts well before you leave the ground. Now, you're the pilot. I'm just the experienced co-pilot sitting next to you, making sure that you get where you plan to go and so that you can avoid bad weather and turbulence along the way. Even when I was still in the corporate world, where I spent close to 2 decades in leadership at a Fortune 500 company, these Medicare conversations were a key part of my daily life. So when I talk about Medicare, I'm not just talking theory. My own family has had to make these decisions too. And that experience has really shaped the way that I think about this business and the type of guidance that I provide. So today I want to walk through a few things that I believe really matter when someone starts Medicare. Again, not from a professional perspective so much as from a real life perspective. So things like freedom versus restrictions, predictability versus surprises, and how these decisions feel much later on, not just today. And this is Coffee with Casey. So grab your coffee or your favorite afternoon beverage and let's get going. That sounds helpful to you? Type me in the chat. So the first bit of advice I'm going to share with you is don't just focus on the monthly premium. And that's probably the biggest one because you see a lot of people start to approach Medicare and they start thinking, well, what's the cheapest option? And they think that signing up for Medicare is just like signing up for their health plan every year at work during open enrollment. I mean, I understand that, but healthcare isn't really about what things cost when everything is fine. It's about how things work when life changes. My mom, Ginny, she lives in a rural area in another state. She's retired, fixed income, Social Security, small retirement plan, all that. So for her, when she started Medicare, protecting her income mattered the most. She's not working anymore. Her income has got to last her for the rest of her life. A free Advantage plan, while it seems less expensive up front, that could have actually been financially dangerous to her because of the potential out-of-pocket cost. And she's also got some key specialists who are treating some chronic conditions. Nothing to worry about. They're well managed, not super serious, but I mean, she wants to keep those doctors. And in her area, there are also limited primary care options that don't require a couple hours of travel. So network changes for her would have been a massive inconvenience. So she chose a Medicare supplement plan. And now her costs are predictable. She pays a consistent monthly premium that she can budget for, a couple $100, and her out-of-pocket costs are extremely limited. So her out-of-pocket, or so her retirement savings, I should say, is protected against big out-of-pocket costs. On a Medicare Advantage plan, the maximum out-of-pocket, the average is about $5,000 to $7,000 in 2026. Of course, it can be higher, especially if just one of the providers you see is out of the network. So for someone like my mom, if she were to have a serious health issue, coming up against that maximum out of pocket would be financially devastating for her. But luckily, she doesn't have to worry about that. Her retirement savings is protected. Her out-of-pocket costs are very, very limited. But there's some additional factors too that were important. she can see any doctor nationwide who takes Medicare. So that means that she can continue to see her current specialist without interruption. She can continue to see the primary care doctors at home without interruption. But then when she comes down here to Florida to stay with us for months at a time, everything works exactly the same way as it does at home. For her, predictability and freedom mattered so much more than just trying to save a little bit more upfront. The second part is to understand the difference between networks and freedom. This is the fork in the road. And this is one that I'd want anyone in my own family to understand clearly. My dad, John, and my stepmom, Donna, are agency founders who are still very, very involved today, by the way. They chose Medigap when they both started Medicare years ago. In fact, there was no hesitation. Medicare Advantage wasn't even a part of the conversation. Why? Well, they've been in this business a long time. They know the ins and outs. They knew they wanted freedom of choice. They wanted predictable costs. And they wanted a permanent strategy that they could keep for the long term. They didn't want to be on that annual roller coaster every day or every year of their plan being discontinued and having to try to choose another plan, trying to decide, well, do I cover my prescriptions or do I cover my doctors that I want to see? And for them, the other thing is that flexibility of being able to see any Medicare doctor anywhere in the country was critical. They spend summers at their vacation home, so having coverage that works the same way there as it does at home or anywhere they travel was extremely important. And they both have Medicare supplement plans. That means they have no networks to worry about. They never have to wonder who takes the plan or if they'll still take it down the road. That's important here too as they're getting care, because if they need to go see a specialist, they can go to any specialist that takes Medicare. No referrals. They don't have to wonder whether a test or a treatment is going to be approved or have to wait to find out. They wanted Medicare to feel simple no matter where their life took them. So what happens when life starts getting real? And it will. This is the part most people don't think about at 65. And I'm going to tell you, it's not just people at 65. It's all throughout life, right? Like we all think we can do it later, don't we? Let's be candid. I know I'm guilty of that too. My mother-in-law, Nancy, retired from the Broward School Board years ago. And like a lot of retirees, she was living on a fixed income pension, Social Security, income that had to last. But what Nancy wanted the freedom to see doctors she trusted, along with predictable costs over time. Fast forward about 10 years, she was battling complications from COPD and 3 different cancers. But during all of that, we never had to worry, and she never had to worry. She was able to see every doctor she wanted. She never worried about networks, never had to beg for a referral. And there was never a treatment that was prescribed for her where we were all wondering if the treatment was even going to be approved. Treatment was prescribed, it simply got scheduled, and she went and had the treatment. And the big thing, there were no major surprise bills to worry about. Nancy got to spend her energy focusing on her health, not fighting with her insurance company. And that's really what a good long-term strategy is all about. Early decisions matter, especially with Medicare. When you're at work and you're going through open enrollment every year, November timeframe roughly, you have your open enrollment, and that's when you get to decide, do I choose the plan with the lowest out of pocket? Do I go with the high deductible plan? Do I go with the one in the middle? And you know what? I'll sign up for a year, and next year I'm going to have that same window, those same choices, and I can always change. My health doesn't matter. But Medicare works differently, because with Medicare, when you start Medicare, whether that's at 65 or whether you're starting Part B a little older, when you first start, within 6 months of starting Part B, all of your options are still on the table. But after that window expires, and I know there's some exceptions, and there's some exceptions in certain states, but as a general rule, once that time frame expires, the options available to you may be limited, and it can start to become difficult, if not impossible, to switch. And this is why I always encourage people to think long-term at the beginning. I recently spoke with a woman who lived in the Tampa area. She wasn't my client, but she called me for help. She had a Medicare Advantage plan. I won't mention the name of the carrier, but she had just found out that Moffitt Cancer Center over in Tampa, a big world-renowned cancer treatment center, she just found out that they no longer accepted her plan. She had stage 4 breast cancer. She's in the middle of treatment. Now, ordinarily, that would have been a time where she might have considered switching to a supplement. But because she'd had cancer and had been treated within the past 2 years, she couldn't qualify medically. So she's now having to find somewhere else to get her care that takes her plan. And that's the part that people don't often realize. The decisions that you make when you first start Medicare, they can affect the options that you're going to have later on. So what I would want my own family to understand, and what I want you and your family to understand, is that if I could simplify this whole conversation down to one thing, it would be this. Don't just think about Medicare based on today. Think about, how do you want your care to work later? 5, 10, 15 years down the road. And I know it sounds cliche, but I see it all the time. It's not a question of if, it's a question of when. How do you want retirement to feel financially? Do you want your retirement income to be protected? And how much flexibility do you want as life changes? Do you want to be able to be the one that chooses where you go and get care? Or do you want those choices to be made for you? Because at the end of the day, let's think about it, it's really not about insurance, right? I mean, it's really not. It's about protecting your freedom, your time, your peace of mind, your retirement income, and protecting the freedom and peace of mind and finances of your loved ones, right? Now, if you're already on Medicare and things have felt simple, you've been able to see the doctors you want, your costs have been predictable, that is exactly what we're aiming for. And usually that means your strategy was designed thoughtfully from the beginning. And by the way, I've put together a short training. We call it the Medicare Enrollment Roadmap, that walks through all of this step by step. So if you'd like access to the training, you can just comment roadmap and I'll be glad to send it to you. So if you're approaching Medicare, or maybe helping out a family member or a friend, maybe helping someone else figure it out, and you'd like help thinking things through, you can go to medicarequotes.com/Facebook and you can grab an appointment with me. You can call the office 954-970-4760. Christine or Liz will get you connected with me or someone on the team, and we'll be glad to chat with you about it. Or just comment guide and I'll reach out to you personally. So let's take a look at some common questions that I get. One that comes up a lot is, and I think you kind of have the idea already, but it's, what would you personally choose for your own family? Or most commonly is, what would you recommend to your mom if she's starting Medicare? That one question comes up in almost every Medicare conversation I have, whether I'm hosting a workshop or even talking to someone one-on-one. And definitely, no question, it's Medigap, because it would always be something designed around freedom, predictability, and long-term stability. And for my mom, for example, that's exactly what I was able to help her choose. For Dad and Donna, being in the business themselves, there was no question they were going with Medigap. Medicare Advantage wasn't even a consideration, not even for a half a second, because they've seen exactly what happens with those plans. They get the same calls that I do. They've been doing it for a lot longer. And it's really heartbreaking when someone calls and says, hey, I need your help getting a supplemental plan. And of course, we're going to do what we can to help. But then they start telling us, well, here's the situation. I've got cancer, or I just had a heart attack, and the insurance company keeps pushing back on my treatments, or I can't go to this hospital or this doctor. They're not in the network. And we find out that it's been more than 6 months since they started Part B. A lot of times it's been several years, and we're in a situation where we can't help them. Dad and Don have been having those conversations a lot longer than I have, and it's heartbreaking. So for them, there was no question. They were getting a Medicare supplement at 65. And that's really the path that I think most seniors should choose. Yet there's some folks where a Medicare Advantage plan might be a good fit, but for almost everyone else, people that value freedom, predictability, stable costs, and limited out-of-pocket costs, the Medicare supplement plan almost always is going to be a much better experience, and it's actually going to cost you less over time. Can people switch later if they change their mind? Sometimes they can, but not always. Timing and health can matter a lot. I recently spoke to a gentleman in Central Florida, also not a client, signed up with someone else at 65, signed up for a Medicare Advantage plan, worked great at first, but then a few years later, he started having some issues. He was diagnosed with serious pulmonary illness. All of his doctors were telling him, hey, you need to go to Mayo Clinic in Jacksonville. That's the best place to go for your particular pulmonary ailment. Well, guess what? Mayo Clinic doesn't take his Advantage plan. In fact, they don't take most Advantage plans. So when he came to me, he wanted help switching to a Medicare supplement plan. And as you can imagine, at that point, he would have paid anything to be able to get into the supplemental plan and get the care that he needed. But unfortunately, he was outside of his guaranteed issue window, and that diagnosis was on his medical record. He was uninsurable. I wasn't able to help him. That's a conversation that stuck with me for a while. So timing and health can matter. Now, if you're watching this and you're on a network-based plan and you're having second thoughts and you're still healthy, starting when you're first starting Medicare or turning 65 is the best time. Second best time is now. And you can always reach out. Be glad to go over your options with you and see if switching might possibly make sense for you too. Why do so many people choose the cheapest plan? Well, nobody wants to spend more money than they need to. Let's be clear. And Advantage gets marketed really hard up front. Why? Because when somebody signs up for an Advantage plan, Medicare sends an annual payment to that insurance company to manage their care. So the insurance companies want to get those annual payments. They want healthy 65-year-olds going on to balance against the folks that aren't healthy. So they advertise all these extra benefits. They have these really convincing paid celebrity spokespeople. They offer all these extra benefits. They tell you that you're missing on things. And but some people see through that and they choose Medigap. But then they often just choose the cheapest premium because most people don't understand the difference between the first year premium and premium stability over time, and why company history is so much more important. Because as a member of the general public, you don't have access to data like that, like a trusted advisor does. And I don't know if anyone watching has followed John Oliver, but about 3-4 months ago, he did a half-an-hour segment on his show on HBO talking about the difference between Medicare Advantage and original Medicare. And it's a half an hour. It's funny. It's got a lot of humor, but there's also a lot of truth. It's definitely worth watching because he does a really good job of comparing and contrasting the difference. Do I really need an agent? Well, it definitely helps. And I'm not just saying that because I'm an agent. Most people don't realize this, though. You're not going to pay more to work with an agent. The premium is exactly the same, whether you enroll with me or someone like me, or go online or call an 800 number. But having the type of guidance that we can provide, well, that can make a major difference long term. We can see things like claims loss ratio. We can see 5 to 10 year premium histories. And we can identify which customer or which companies are better with customer service, which ones keep it in-house versus outsource. We have a good understanding of which companies pay claims faster than others. We can see financial ratings. So there's a lot of additional insight and additional guidance that we can provide you. And again, we don't work for free. We get paid by the different insurance companies that we represent, but the premium's always going to be the same whether you enroll with us or whether you enroll direct. I always tell people it might not cost you more to work with me or someone like me, but it very well might cost you more not to. At the end of the day, Medicare isn't just about coverage. It's about protecting your retirement, your peace of mind, and that of your family. And if these were decisions being made by someone I love, just like some of the decisions that my family members made, these are exactly the type of things that I'd want them to understand. And so that's why I want you to understand this too before you or someone you love starts Medicare. Again, if you'd like help, go to medicarequotes.com/Facebook. If you'd like to grab some time on my calendar, you can call the office 954-970-4760. Or again, just comment guide in the comments and I'll connect with you directly. Thanks so much for being here. I'll see you next week, 3 p.m. Eastern time for Coffee with Casey. Have a great day, everybody.